Do you know what questions are asked in an aged care facility for registered nurse position or any carer position? If not, you should watch this video. Hey guys, this is Rima and welcome back to my channel. I talk about nursing and life. This video will be helpful for those people who are looking for a job in an aged care facility in Australia. Just a disclaimer, these questions are based on my personal experience and from my research, I have found these questions which are generally asked in an aged care sector. So please be mindful before going for an interview, you should also do your own research. I have included the questions that are asked generally. Depending on the facility you have applied, which is high care, low care, or dementia support, the questions may vary. So let's not delay and dive in the interview questions. First thing you need to know before you start your work in aged care facility is about what are the standards of the aged care facility. So the interviewer may ask you a question directly asking about, do you know what is aged care standards? How many aged care standards are there? And how can you implement these standards on your care for the consumers? Or they may also give you the situation based question. So you can find these answers on the government website of the aged care, such as myagedcare.gov.au. I will put all the website details in my video description as well, so it's easy for you to go and read by yourself. So there are total 8 standards of the aged care. As you can see also in the picture here, the picture itself speaks up. So there's a small detail in the picture as well, but if you need more detail, then you can go in the website and read more about it. But I'm just gonna give you the example how you can tell the interview that you're gonna use these standards on your quality care. So for example, in number 1, you can see the first standards is consumer dignity and choice. So the interview may ask you, how will you use this standard to maintain the consumer's dignity and choice? Or they may ask you to provide you an example how you're going to use the standards to meet the consumer's need. All right, so I will give an example how you can use this standard. For example, if you want to use the standard 1, what you can do is, let's suppose I'm going to do the dressing for my resident. Now I go to the consumer and then say, hello Mrs. Smith, how are you today? My name is Rima. I'm one of the nurse looking after you today. So I will explain all the procedures that I'm gonna do. So I will say, Mrs. Smith, I see you are due for the dressing change. Is it okay if we do it now or do you want me to come later? So by doing this, you are giving the choice to your consumer about the time. So if she is doing something important, then she can say, oh darling, I'm doing something like this at the moment, is it okay if we do it later? And you say, of course, when you are ready, please let me know. So by this way, you can see I have given the choice to my consumer to do the dressing at her time. So this shows how I have implement this standard and then how I have given the choice and respect her dignity and respect her choice to do the dressing time. Similarly, if you are an AIN or assistant in nursing, you can ask Mrs. Smith, hi Mrs. Smith, good morning, how are you? I'm here to help you to start your day. Is it okay if we start now? Do you want to take shower or do you want to do just the sponge bath today? Like this, for example, you're just giving the choice. And then rather than picking up the clothes for her, you can tell Mrs. Smith, what would you like to wear today? So this say, like, you are giving lots of choices to your consumer. This is how you can maintain the choice by taking the consent from her, like, is it okay if we do the sound now? That means you are saving her dignity because you are taking the consent from that person. So this is how you can maintain the dignity and give the choice to that person, and this is how you maintain the standard 1. Yeah, so you can give these examples to your interview if they ask you how you're going to implement these standards. I will give you another example. So let's say about to maintain the standard 2, which says ongoing assessment and planning. So you involve your client while you do this assessment and planning. And if you are not able to involve your consumer during this case, then you should involve the next of kin, or you should involve the family. And then you should always do like a regular assessments, regular planning, regular reviews, regular update of the care plans. That is how you're going to maintain the standard too. So this goes on and on like this. So your interview may pick one of the standard and ask you how you're going to maintain the standards. So make sure you know about the standards before you go to an interview questions. All right, let's talk about another question. Question number 2. What are the National Aged Care Quality Indicator Program and why are they important? So being a registered nurse, you need to know about this. What are the quality indicator and why it is important? To describe it in a simple way, you can say these quality indicators helps to monitor and measure the quality of performance of an aged care, and it also support the continuous improvement in the care they provide to the consumers. So here in the pictures, you can say there are 11 quality indicators which are important to maintain the quality of that aged care setting. So these quality indicators are also used by the Aged Care Commission to rate that certain aged care setting. So depending on what kind of cares the consumers are receiving and what kind of problems that they can identify from this setting, they will rate that organization in where you can go in the Google and see about these ratings as well. So these things are very important to an aged care, to run an aged care, because it determines their quality and performance. So it's very important. So as an RN, you have a vital role to maintain the quality of that aged care. Okay. So these questions will be asked in an interview. Moving forward, the third question they may ask you is about ANAC. So they may go like, do you know what is ANAC and what are the assessment criteria or what are the assessment tools that are used in an ANAC? So they may not ask you like, a deep about the ANAC, because the higher the level goes, you need to know more about the ANAC. So if you are applying for the position of the care managers, service managers, deputy or quality team, something like that, they may ask you about the deep down about the ANAC. But for the general RN position, they may not ask you to go deep. They may just ask you what is ANAC and what are the assessment criteria tool that may be used during the ANAC. So in a simpler form, what is ANAC? So the ANAC refers to the Australian National Aged Care Classification Funding. So here it determines how a resident can get a funding. So because in every facility, depending on the resident condition, the funding is provided by the aged care providers, and this tool is used to determine how much funding the resident is gonna get. And there are four assessment criteria that they're going to use to provide the funding. So first one is physical ability, which includes the complex healthcare of the resident as well. And another one is cognitive ability. So it determines how the resident's cognition, low, moderate, severe, how is the condition, how is the cognition level. Third is behavior, and fourth is mental health. So these four classification, these four things or these four aspects help them to give funding to the resident. So this is run by the assessors separately. They come from like departments and they do the assessment of that resident and then provide the funding based on those things. So as an RN, you need to know when like there's a certain change in your residents, such as there's certain deterioration in terms of their health, physical health, mental health, or any terms of behavior, then you need to know and then report it to your manager so they can call the ANAC team and do the assessment furthermore. So they may ask you if you know about this or not, but they may not go like deep down in there and then ask you, well, okay, tell me about the classification, tell me about the funding, how does it works, and blah blah blah. So as an RN, you need to know just generally what is ANAC, what are the assessment factors that may affect, and then how you gonna report to the manager and how you're gonna identify this thing on your resident to increase their funding or as per their need. Okay. And also, if you are working as an care staff in that home, then you are the first one who is gonna identify if there has been any change on your resident. So care staff also need to know if there's any kind of physical decline, mental health decline, or behavioral decline, then you need to report to your RN so they can also furthermore report it to your manager, and then they can do the further review, and then they can get further more care depending on how much they are getting for their funding. For example, if there was a resident who used to work very good, and suddenly he deteriorated, he went to hospital, or suppose like he had a stroke and he went to hospital, and when he came back as in bed bound. So now, because there is a decline in the physical health and there is a decline in the mobility, now we need to ask the ANAC assessor to come and check on them, and then we need to increase their funding because the care demand has been increased. So these kind of funding help us to cover, and then also help the resident to get the proper care as needed. So ANAC is important in that aspect. Okay. All right, so moving forward, let's talk about another question that may ask you. So another question is about restrictive practice. So in an aged care setting, it's a big issue when, like, someone is unintentionally under the restrictive practice and no one is aware about it. So that's why as a registered nurse, you need to know what is restrictive practice, what are the type of restraint that are used in an aged care, and what is the common one, and when is the condition which may not be considered restrictive practice but it may look like it's a restrictive practice. So you need to aware about these things, especially if you are working or if you want to work in dementia center or dementia facility. Okay, so I won't make a long video on this because restrictive practice itself is a very complex thing, and sometimes it's very hard to determine what is considered restrictive practice and what is not. So you should always be up to date with your facility or home. You should always have a list, what who are under the restraint and who are not under the restraint. Talking in general, there are 5 kind of restraint: physical, environmental, chemical, mechanical, and seclusion. So the most commonly used are environmental restraint and chemical restraint in an aged care facility, if it's especially the dementia unit. The interviewer may ask you about, do you know what is restrictive practice, and do you know how you consider if someone is on the restrictive practice, and they may ask you what are the special consideration, what are the special needs that person, or the thing you may need to do when someone is in restrictive practice. So you need to know about this. So I will just give you the example of the chemical and environmental because these are the most used one. So let's talk about the environmental restraint. So the place where I work have the keypad access. So wherever you go, there is a keypad access. You need to put the keypad number, or you need to have a key with you to go in and to go out of that facility. And because that facility is the dementia facility, the resident may not have access to those key cards or those numbers to go in and out. So they are considered an environmental restraint. However, not all the residents residing in that facility will be considered environmental restraint, which you need to know. Because if someone's mobility is good, if someone is able to walk around, if someone is able to go out, go in, if such, like, for example, if someone can walk, they will be considered under environmental restraint. However, those who are immobile, bedbound, and needs extreme support to walk or do their ADLs, then they won't be considered environmental restraint. So if someone from outside come and ask you, is this the environmental restraint applied to all of the residents residing in this facility? Then you need to think about and tell them if it is or not. So in an interview, they can also ask you, if someone is immobile, will you consider them as environmental restraint? And it's a kind of trick question. So you would say no, because they are not able to walk. So it won't be considered as environmental restraint. So make sure you read about this restraint, okay? And similarly, talking of the chemical restraint, this is the most commonly used in the dementia facility as well. And then this is very tricky one. If someone have already the diagnosis that are related to mental health and they are on certain kind of medications, then they won't be considered as a chemical restraint. So chemical restraint are the psychotropic medications that are used on a person to control their behavior. For example, if someone have a depression and we are using the citalopram for them, that it won't be considered as the chemical restraint, because we are using it for their depression, not for their behavior. So these kind of things are very important when you talk about restrictive practice. Similarly, before using any kind of restrictive practice, you should always take consent. There should always be a review. You should always commence them on the behavior chart. There should be certain kind of assessment done before starting that practice. You cannot put like someone directly on that restraint and then tell them, okay, this person have this behavior, so we need to give them this medication. No, it doesn't work that way. There has to be lots of like assessments beforehand. There needs to be lot of like risk benefit assessment by GPs, by geriatrician and everyone, and then they need to tell, okay, this is unsafe for them, so we need to control this behavior, or this is unsafe for the people around them, so we need to control this behavior. So it has to be come from the GP, it has to come from the geriatrician. The consent has to be considered before you start them on the restraint. And if the restraint has been started, then that person needs certain ongoing assessments. That person's medication needs to be reviewed in 6 weeks if it's the first time we are using it, and if it's been continued, then we should review it every 3 monthly. So restrictive practice is very important thing in an aged care, and it should be used very considerably. So as an RN, you need to know what kind of restrictive practice it is and how we're going to use it and why it is important. Okay. As an RN, you also need to know if someone is added on like PRN or as needed medications, psychotropic medications to control their behavior. You need to make sure what indication has been given in that certain medication. So when GP chart any certain kind of this medication, they usually put the indication. If the indication says that medication is for anxiety, then you cannot use for another purpose. You cannot use to control their behavior. When you use the restrictive practice, you need to make sure they are on behavior chart, and you need to make sure if the medication's been used, and you need to make sure there is detail about the behavior, or there is detail about the things, why you use it, how you use it, how many you use it, how many per day you are using it, and why you still have to use it, and how was the effect. If it's still if it doesn't have any effect on the resident, it needs review. If it have good effect, then you need to mention the medication had a good effect, and how was the behavior after the resident took that medications. So it's very complicated. So make sure you know about your restrictive practice. You need to make sure you know why it is used, how it is used, what was the effect, and if the ongoing assessment has been done, and if there has been 3 monthly review for those medication. And make sure you take the consent before starting the medication, both verbal and written. Okay. So moving forward, let's talk about another question that they may ask you. So they may ask you, what is SIRS? Can you give me an example where you have been able to manage the SIRS, or how did you report the SIRS, and what are the things that will be considered under the SIRS? So to be general, I will just give you a little bit of information. What is SIRS? So SIRS is its full form is Serious Incident Response Scheme. So there are certain things that comes under these SIRS, and as an RN, you need to know what is SIRS and what are the things identified will be come under the SIRS, and how will you manage it and how will you report it. Okay. So there are eight things that will be considered under the SIRS if used. Number one, physical abuse, financial abuse, emotional abuse, sexual abuse, unexpected death, unexplained absence from the facility, physical and chemical restraint, and neglect. So all these things comes under the search. If you see all these things or any of these things happening to your resident, then you should consider and report to your manager as a search. So for example, if you see one of your care staff using the physical force to make your resident change the clothes, or you see them emotionally abusing, saying, okay, if you do not do this, I'm not gonna help you to do that. For example, if they are not compliant with their care, and your care staff says, okay, so if you do not let me do this, I'm not gonna give you any food. So that kind of things, it's an emotional abuse. So you need to report all these kind of things. And also, like I talked about before, physical and chemical restraint. You see, So if you are using the physical and chemical restraint without any consent, then it will be considered serious incident and it will be reported to the Aged Care Commission. Depending on the search priority, it is important to inform the Aged Care Commission. So, if there has been any physical or psychological illnesses or injury that needed the immediate medical attention, then it will be considered as the priority one search, which will need to be reported within 24 hours to an Aged Care Commission. So you need to identify which one is priority one and which one is priority two. Those, for example, those like unexpected death and unexplained absence from the facility will be considered as a priority one. Okay. And your interview will ask you, okay, can you tell me the example where you have identified the search and how did you manage it? So you have to tell them a situation that you have faced them. So for example, I recently gave an interview where they asked me this same question. So I gave them an example where there has been two residents who were physically violent and aggressive to each other and fighting. So you can use such examples to explain the search and then how did you manage it. Okay, two of my resident is fighting very violently. I am not able to separate them, so I had to call the police. Okay, I called the police, they helped me to separate them. I did the assessment on both of them. One of the resident is with the care staff and I'm with another care staff. I make sure both residents are safe. I make sure there is no any injuries. If there's injuries, I make sure I call the paramedics for the help to get them in the hospital and to get the further treatment. So because I had to send that person, I had because I find identified that person is severely injured and then that person actually needed immediate attention from the health professional, then it comes under the search one, priority one. But if my resident was not injured, there was just a little bit of fight, but none of them were injured, both of them are is okay and I'm able to manage them at the home, then I further manage it at the home. So I do all those assessments, I do the vital signs for both of them, I provide the emotional support to both of them, I call the next of kin of both of them, I apologize to them, or I do the open disclosure to them and everything. And I commence them on the vital sign chart, I commence them on the sighting chart, I commence them on the behavior chart, I commence them on the pain chart, I commence them on the food chart, I commence them on the sleep chart, because all these things may be affected after having a fight with each other. And like it may further deteriorate the thing, or it may help us to identify, if there has been any change after the incident. It will I also need to identify if there was any confusion, new confusion to any of the resident. I need to do the delirium assessment, I need to do the urine test, just to make sure just to rule out any kind of infections that have make them make them confused or anything like that. So after the all this thing happen tomorrow on huddle, I need to make sure I inform all of the people. We do the further investigations, we watch the camera or anything like that. And also we need to make sure we do the GP review. We also need to make sure if that person need further review from any kind of team such as geriatrician or grace team or any other outside dementia support Australia team or anything like that. So when that kind of incident happen, you need to make sure they are safe. You need to prioritize priority one or priority two. You need to make sure what you did furthermore to help them, not to aggravate the situation, or to help them, or to early identify any kind of changes. And you need to make sure there has been there will be the ongoing assessment for them for the general well-being. And you need to make sure it doesn't happen in the future, and you need to make sure what really caused it, and you have treated that. And you need to make sure if any kind of referral was needed, and you need to make sure you inform your next of kin managers and report it as needed. Okay, and daily progress note, of course. So this is how you manage the search. And to know furthermore, I have this PDF. So in here in this PDF as well, you can see what sort of things are needed, what are considered as the search. So go through the PDF. You can also find this on the link below, I have given it. So read more about it. This is the confirmed question that you will be asked in an interview. Okay, all right, so let's talk about another situation. So another is pressure injury and IAD. IAD refers to the incontinent associated dermatitis. So as an RN, you need to know what is pressure injury and what is IID, how you will difference about it, and how will you stage it, and how will you manage it, and how will you report it. In terms of reporting, it may depend on the facility policy, which one is reportable and which one is not. But in terms of management and treatment, it's general in all the aged care setting. Okay. So let's say the interview may ask you about, can you tell me about the time where you have seen the pressure injury on your resident, or you have identified the stage 1, stage 2, or any kind of stage of pressure injury, and how have you managed it? All right, so I will say, depending on what kind of stage it is, the management is also different. But the main thing you need to know about in the pressure injury and IID is how you will differentiate it, what may be the types of both of them, and how will you manage it, how will you treat it, and if it is reportable or not, how will you like find it out, and how will you inform the next of kin, and how will you involve the multidisciplinary team. That's all. Okay. And for SMK staff, you may also need to know about this thing, because you are the first who will identify. So if there is any kind of skin change, doesn't matter if you don't know how to identify as in care staff, if it is pressure injury or IAD, it's okay. You can always come and report to the RN, and then they will further investigate what it is. But as in care staff, you need to make sure any skin change, inform your RN, because furthermore, it may, if you report it late, it may already be delayed, and it may have already progressed to the in a situation where we may not be able to manage it. So make sure any skin change, even slight redness, monitor and inform your RN. Okay. Another common question is about the fall. Everyone must know about the fall. So usually all the facilities have the similar kind of policies in regards of the falls. And then the interview may ask you, like, your situation based question. For example, you were passing by your corridor, you saw a resident lying down on the floor. How would you manage the fall? So okay, so now you need to know how will you manage the fall and what you will do after the post fall. So depending, I don't think I need to explain all this, but I will just be quick. So depending on type of fall, witness fall and unwitnessed fall, you will manage. So if it was the unwitnessed fall, you make sure the resident is safe. There is no any danger around the resident, and you do the assessment. You call for help and you do the assessment. So you do the head-to-toe assessment. You find out any visible injury, any visible fractures, any kind of bleeding or anything. See. So for example, you can do the check on limb shortening. If there is any shortening of the limbs, then there may be a hip fracture. Make sure there is no skin injury, minor skin injuries, there is no any visible bruise or anything, hematoma. And once you find out the resident is safe for transfer, then you use the full hoist to transfer the resident in a safe place or in their bed. And once you do that, comments them on the vital sign chart, comments them on the neurological chart, take the history from the resident, how he fall, what really happened, what made him fall. If he doesn't remember, if it's the dementia unit, depending on that type, you also need to do, like, further more investigation. But if it's like high care or short care, where the resident is aware about, have the good cognition, and they can give you the detail on, depending on their detail, you can make decision as well. Make sure you inform it to the next of kin, do the open disclosure and apologies. Make sure you tell the GP for the review, and if there is no GP to review, then you can contact the after hour GP review to come and see the resident. And depending on the resident medication, if they are on any kind of anticoagulant and it was unwitnessed fall, and you may think it was a head strike or something like that, make sure you send them to hospital to do the CT scan, so there is no furthermore hemorrhage on the brain or anything like that. And if you know the resident didn't hit the head, and if they are not on the blood thinner, you make sure you monitor them for close, monitor them for 24 hours, comments them on the vital sign chart, pain chart, sighting chart, behavior chart, rule out any kind of confusion, infections that may lead to the fall, and do the further review. If the resident has been falling very frequently, make sure they should be on grass mat, they should be on chair sensor, bed sensor. Ask the physio to review what kind of sensors they will need, if there has been any mobility change, depending on the change of the mobility, what kind of care they will need. And also provide the hip protectors to make sure there is to prevent them from serious injury or something like that. So it again depends on the type of the facility, depending on the resident behavior, cognition, and fall history. You will manage this kind of falls, so you make sure you know what to do on what kind of situations, and you'll be okay. So this is the most easy questions I think that will be asked in aged care indeed, but however it may get complicated depending on the resident condition. Okay, so usually in terms of the vital signs are taken like 15 minutes for first hour, and then half an hourly for second hour, and then 1 hourly or 2 hourly for another 2 hours, and then 4 hourly. Okay, and neurops is same as well, and it's usually done for 24 hours or 20 hours depending on again the facility policies. And make sure you do the incident report, and do the good progress note, and give proper handover. So in regards of the fall question for the care staff, you can say if you see someone on the floor, then you will call for the help at first, and I will make sure whoever is on the floor is safe and there is no any danger around the area, and I'll wait for the help until the RN comes, and then I'll make sure the resident is safe until then. I'll press the emergency button if there is any, or you can also say you will give a call from the deck phone, anything like that. So you just need to make sure your resident is safe when you are with them, and make sure there is no further deterioration, and wait for the help from RN. So once RN is there, you just follow the direction as per the RN said, and you can also tell the interview that I will wait for the RN to come and assist, and I will also help the RN in between as needed. All right, so another clinical question. This is about the palliative care. So the interview may also ask you about the palliative care. So they will ask you what is palliative care, what sort of comfort care will you provide, what sort of crisis medication you will provide, how will you view if someone is for the palliative care, how will you inform the next of kin, how will you involve the next of kin. So these are the questions that may be asked in your interview. So like for example, they may give you the scenario. So for example, Mrs. McAvey is 94 years old lady. She has been deteriorating recently. In a few weeks, her oral intake has decreased, her mobility have declined, she have had like recently 3 falls, and we have also found out like there is a redness on her sacrum, and she has also the complex health care. The family have decided not for the hospital transfer. So how will you manage the resident at the home? They will expect you to answer about the palliative care and the comfort care that you will provide that person in the home. All right, so in this scenario, like I said, as the family have already decided not for the hospital transfer, then it means she's not for the active treatment. However, you need to make sure you talk with the next of kin, and then find out if they are looking for any sort of management, or they are expecting any sort of hospital in the home thing. You need to make sure what kind of treatment they are expecting. Okay, so in this situation, talk with the GP, talk with the next of kin, talk with your manager or deputy service manager, and then make sure you do the proper case conference for her, so there is no any further delay, or there is no any misunderstanding between you or family's expectation. And then if the family said, okay, we are happy to move on with the palliative care, then involve and refer or ask your GP to provide referral for the palliative care. And once the palliative care team is here, they will help you to guide how to provide the comfort care to that person. They will involve pain assessment, they will involve skin assessment, they will involve how to reduce the fall, they will involve how to reduce the agitation, anxiety. They will also help the family to go through the grieving. So you need to make sure when there is a palliative patient, you always involve the palliative care team. Okay, And if you already know that person is going for the palliative team, for palliative care, then you need to ask your GP to chart the crisis medications. So these medications helps that person to be comfortable during the end of the life. And once it is decided that that person is for the comfort care, then you need to make sure what things have you done to prepare him for the comfort care in your home. Make sure we involve the lifestyle team, ask them to provide the spiritual care, ask the family, is there anything that we can do or make them like feel comfortable when they are at the end of life? Was there anything they had requested to do during this time or anything like that? Ask the care staff to do the regular repositioning, oral care, eye care, for comfortness. And for the care staff during the palliative care, they can answer to the interview as like, you will help the RN to make the resident comfort, you will provide the repositioning, you will provide the eye care, mouth care as needed, and you will also do the pressure injury area care by repositioning, changing into the mattresses and all. And furthermore, for the comfort care, you can say you will also attend the documentation as needed, and you will make sure like if any update or any changes, then you will report to the RN. So I think these are all the general questions that I have involved that may be asked in an aged care setting. So apart from these aged care related questions, there is already the another interview questions like, can you tell me about yourself? Can you tell me what are the qualities do you have as a nurse? How will you use your qualities to improve our home, or like, how will you use your qualities to have a proper communication, to have a proper collaboration with the team? How will you manage there if there is any, like, hectic situation, or how will you manage if there is any kind of outbreak? And these are very common questions that you will expect in the aged care setting or any kind of interview. They will ask you, how will you manage stressful environment? How will you work if there is shortage of the staff? How will you manage if there's a conflict between your staff? As a team leader, what will you do? This sort of things are very common, and I expect you to know all these questions already. And if you have already passed your interview and you are going to start your first job as a RN in any setting, aged care or hospital, don't forget to watch my another video which I have already uploaded. It says, like, what are the things that you will need to know if you're working in an aged care setting, and how can you start your day, or how can you prepare for that job. I have put the video in the link as well. Please click here to watch that video. So I hope this video has been helpful for you. If you want to contact me, you can contact me on my Insta and also on my TikTok, and also put the comment if you have any questions. If you want to see video on any kind of topic that's related to healthcare in Australia, then you can also put in the comment box. I will try to do my best and give you another next video. So in another video, I may gonna talk about what are the interview questions that are asked in a hospital setting. This was only about the aged care setting. Okay, so hopefully this video has been helpful, and if you like the video, please do not forget to like, comment, and share this video with your friends, and also please subscribe my channel. For now, bye.